Current tools for diabetes management now include weight loss injections. According to recent studies, these injections can reduce HbA1c levels by up to 2%. These drugs are among the most effective available. Their main drawback is their high cost. Diabetes prevalence among Israeli adults is approximately 9.8%. Glycemic control is achieved in only about 60% of patients in the lowest income quintile, compared with roughly 80% in the highest quintile. High prices of diabetes medications risk widening these gaps, as rising out-of-pocket health expenditures are often unaffordable for low-income families living on about 5,400 new Israeli shekels per month. Drug pricing policies are shaped by a range of underlying economic, political, and ethical principles. These include cost-effectiveness considerations, budget constraints, and neoliberal views emphasizing competition and free markets. A clear example is the United States, where medications purchased in the private market cost around $1,000 per month. In contrast, social democratic principles of equity and prioritization of vulnerable populations are reflected in subsidy mechanisms, such as specific Medicare programs in the U.S., which offer price reductions to low-income groups under strictly defined conditions. Adam Smith recognized in the 18th century that material rewards shape human behavior. In the early 20th century, Frederick W. Taylor formalized the use of monetary incentives to increase factory productivity. Since then, incentives have become a core policy tool in liberal and libertarian traditions, aiming to influence behavior through non-coercive mechanisms. In healthcare, incentives have been applied across a wide range of domains. In meta-analyses that we conducted of randomized, controlled trials examining incentives for cardiovascular risk factors using objective clinical outcomes, we found overall positive effects, some of which reached statistical significance, although the average clinical improvement was modest. Our primary objective in this trial was to evaluate the effect of conditional medication rewards on HbA1c improvement over 6 months compared with standard copayment. The trial was a randomized controlled study conducted from 2019 to 2023. Patients were recruited from outpatient clinics within Clalit Health Services located in lower socioeconomic status neighborhoods in the Greater Jerusalem area. The study was approved by the CHS ethics committees. Eligible patients were required to have type 2 diabetes for at least 6 months and no more than 15 years, be aged 30 to 70 years, and have an HbA1c level between 8% and 12% measured within 2 months prior to trial entry. Exclusion criteria included treatment with multiple daily insulin injections and hospitalization for cardiac reasons within the preceding year. Initially, eligibility was restricted to patients with a diabetes duration of less than 10 years, aged 40 to 65 years, with HbA1c levels between 8.5% and 11%, and no use of insulin therapy at baseline. Due to recruitment challenges, the inclusion criteria were subsequently broadened to the final parameters described above. Recruitment difficulties stemmed from multiple factors, including concerns about participation in clinical trials, concerns about medication costs after the end of the trial, and aversion to lottery-based mechanisms inherent in study randomization. Furthermore, the study period occurred during the COVID-19 pandemic, including periods of lockdown, during which many individuals were reluctant to leave their homes. Patients in the intervention group were eligible for a benefit of 150 new Israeli shekels. After 3 months, a reduction of 0.5% in HbA1c resulted in an additional 300 new Israeli shekels. And after 6 months, an additional reduction of 0.3% entitled patients to 150 new Israeli shekels. The control group paid standard co-payments, and after 6 months were eligible for a 150 new Israeli shekels bonus for completing the blood test. The vouchers were redeemed exclusively to obtain medications for managing hypertension, lowering cholesterol, and treating diabetes. A modification to the intervention plan occurred in the first year after 35 participants had been enrolled. The payment for the first 3 months was initiated. Additionally, the change involved increasing the payment from 100 shekels at 6 months to 150 shekels for participants in both groups. This increase was made possible by a grant from the National Institute for Health Policy Research. All participants were followed by research nurses by phone calls throughout the study period, offering support and reminders and monitoring for side effects. The study was funded by Israeli National Institute for Health Policy Research and the researchers' research grants.